Okay guys, I'm going to try to do about a, oh, I don't know, 10-minute video for each of these last 3 chapters, and I'm literally going to hit on the things that I know have consistently been on HESI and NCLEX. Not that they're not important, just that if you you typically don't see a lot of dermatological drugs unless you're in dermatology. Same thing with the other 2 chapters, so I'm going to hit the high points on this one. Do review the anatomy, physiology, and function of the skin. Know that the HESI question for this one is that if I break that skin barrier, I am inviting infection into my body. That's the number one thing they want you to understand about the skin, is that it's a barrier for infection. On the second one here, when we look at some different disorders and infections, understand that infections can be bacterial or fungal. So depending on what type of bacteria it is, that's how they're going to treat it with an antibiotic or antifungal medication. And then we'll come back to some of these different ones when I scroll through here. And then the last one we're going to look at is the nursing care plan, because that's where all the important things for this chapter are. So I'm literally going to scroll through, hold tight, understand that if this is not intact, that you provided an opportunity for infection. That's the big one there. Another thing, when we're using topical antibacterial drugs, especially to rub on the skin, that the nurse needs to wear gloves. That's a number one question that's typically asked. There's a lot of stuff on neomycin lately in Neosporin, neomycin on TikTok, I've noticed. On our anti-acne drugs, when we use these, I want to point this out here. Some practitioners do use oral contraceptives to help with acne, and then note that if we have a lot of our anti-acne drugs make us more susceptible to sunburn, so teach them appropriately to stay out of the sun while they're taking those medications. I'll get to those again when we get to the nursing process. A little bit about some of the antifungals. I think I mentioned that one to you guys in class. I had an individual that had an antifungal problem. Usually the antifungal that they talk about here is either your infections like your tinea, your ringworm, or yeast infections, athlete's foot. I think I even mentioned in class how women with large pendulous breasts tends to get yeast infections under their breasts, especially if they've been taking antibiotics, because it decreases that normal flora. So we use either skin creams or powder to treat those. Again, making sure that the area where they're putting it is dry, and if possible, it can be open to air is a benefit. And then place either the cream or the powder on with gloves again. A little bit on antivirals here. They don't talk about that much. Usually we associate those with our herpes simplex 1 and 2, I think, of cold sores or genital warts. So those 2 issues with those. Take it as soon as an outbreak occurs, and use protection during intercourse so that you don't transfer that to a partner, and make sure the partner gets treated also. Keep scrolling. It'll talk a little bit about herbs, but that hasn't come up on board, so I'm going to kind of skip over that. It talks a little bit about sunscreen, when we should, how we should use that, and if you'll know, we'll talk about it again in pediatrics, but we want to encourage the use of sunscreens, especially anytime anybody's outside, so that we can decrease that risk for skin cancer. Not talking about ateneoplastic, so that's those skin cancer drugs. We won't talk about that here. That's not usually been on any type of NCLEX or HESI question. A little bit about wound care drugs, just to note that sometimes we'll have to have those if I have a particular problem with the skin, or a shearing problem with the skin, or they have an open sore and we have to debride it, but I haven't seen anything go into deep on that. Let's look at the nursing process here. So on the nursing process, it mentions a little bit about some of those therapies, but telling you to do a good overall skin assessment to understand what's going on with that individual. I'm going to scoot down here to my implementation. And then when we're looking at that implementation, the nursing teaching thing is to make sure that that skin's always clean and dry before we apply the medication, and then always wear gloves when we're doing that. It does mention if it has something that could could settle, that we make sure we're shaking that before we apply it. That's it on that one. And then evaluation is obviously if whatever we're using it for goes away, then we're following up to make sure that their skin issue is clearing up on them. Kind of read through the key points there, and that's all for this chapter.